George Maniel Sr. and I we walked from Gallup all the way to Santa Fe on this liquor issue. Number one, I don't know how many of you joined us when we walked that I-40 all the way down. Something to remember, I think we forgot about that. Now, when this thing happened, we come back together and we start pointing fingers again. And I think the city of Gallup needs to come to some sort of a plan to oppose liquor. We fought liquor establishment. It's very hard to fight them. Even George knows that. Their lobbies are very powerful. We, as a county commissioner, I never approved any renewal of alcohol license. But we get overruled at the alcohol and gaming in Santa Fe. You know all about that. These are things that we did, and I did on my side of it. When is Gallup and all of us needs to wake up? It's happening. Detox, we manage it, we fund it, and I didn't realize how many people go through a month. 2,400. I know the city of Gallup residents, I see a lot of you here. You make money off Navajo. What is happening? Why is the increase in 2,400 per month? Why? Is it that you're just picking people up and just taking to detox instead of taking to the hospital where they need to go, some other places? These are questions I will give you. I'm not going to sit here too long because I'm going to get up and talk again, and George's rules will go out the window. I am really upset too. We need to come put our heads together and take care of this alcohol thing together. And that's what we need to do. We need to start talking to business people. We need to start opposing alcohol and do all of that. Thank you.
President Shelly marched with us on the March to Santa Fe, but I'm here to talk about how it got originated and what we were doing. Margaret Munoz is here and knows that we spent many hours at her house in her kitchen talking with Ed, trying to put plans together. This all started back at that time, almost identical to what we have today. We had a fragmentation of services, people were on the streets, and the big issue that Ed brought up at that time, and remember that he had been mayor for a number of years, then he subsided from running for office, and then he came back to address this issue, and he made it a campaign promise that he would address this problem on alcoholism. Then in the late 80s, the last year and a half of the 80s, and into the first few years of the 90s came this huge movement that led to the Fighting Back Initiative. And it was because in January of '89, there were 31 deaths from alcoholism, either DWI accidents or people freezing on the streets or being run over by a train. And Ed brought up the issue and said, if that were any other problem, if out at the mines 31 people died in a month, the public would be screaming for something to be done about the problem. And he says, here we have a problem of alcoholism deaths, and nobody's doing anything about it. In the meantime, over at the hospital side, we were putting together a group of our managers to try to tackle what we consider to be the most important problem of this community. Just as an organization, we said, where do we need to put our efforts? And we came upon that same problem. So we tried to figure out how are we going to initiate an effort, and one of the things that came up as a suggestion was that we march to Santa Fe and that we bring attention to the problem to the elected officials, and we get some monies to address the problem down here and come up with a solution. So we decided we needed to reach out to Ed, and we'd go see him and see if he could help us, not knowing that over in his office, he was thinking, time is running out on my term, I haven't addressed this problem, I promised to do it. And when we came in and sat down and said, we want to put this together, he said, let's do it, let's get it done. So then, just a little bit later, there was an accident. And a fellow named Mr. Christie ran into a family head-on. He was DWI, and he killed the grandmother and the aunt and the baby daughter of Mrs. Vega. And her daughter was named Jovita. So Ed and I got together, again, over at the kitchen there in their house, and he said, you know, I think we need to go ask if we can name this march a Journey for Jovita. Because you can either take the position that it was just another death caused by DWI accidents, or you can say this was a child that had a future, that could have become a teacher, or a politician, or a doctor, or mother, and her life was snuffed out like that. But in particular, this accident was important because it was an Anglo who ran into a Native American family. And so for once we said, you know, now we can bring the attention to the universal aspect of this problem to everybody. Because prior to that, everybody's thinking this is a Navajo problem. And Ed said, but we had an Anglo who was drunk, and we have an Anglo bartender that served him. Now what are we going to do about the problem? So we set out to organize the March to Santa Fe, and a lot of people said this will never get off the ground, you're not going to go anywhere. And so we initiated going out to the chapter houses, we went to the local organizations, and one of the things that we kept hearing over and over, they said, look, the police have tried it, the churches have tried it, the hospital has tried it, the mayor has tried it, you're not going to go anywhere with this. And when we had our meetings, when Ed and I talked about it, we said, you know, the difference is no one's ever tried it all together. Every group failed because they were too small. So we went out to see Mrs. Vega and asked permission to name the journey after her daughter, and she gave us permission. And we left there, and Ed said, you know what? This is really going to happen. And I looked at him and I said, well, I was driving. And I said, well, sure it's going to happen. He said, well, until this moment, I didn't think it was going to happen. I said, well, how can you say that? We've been working together on this for a month. He says, I know. He said, I worked on it because my philosophy, whenever somebody would criticize me, I would tell them, you know what? If you don't have a better idea, then follow mine. And when you said we're going to march to Santa Fe, he says, I was thinking and I couldn't come up with a better idea. So he said, okay, so I thought, well, I'll go along with it, but he says, this is going to happen. And being as astute as he was, we're on the march, and he says, you know, we have a problem. We have a problem. We're going to get there, and then what? Nothing's going to happen. So I said, okay. He said, well, we have to think of something. And actually, all the time, he's kind of the thinker, but he's telling me, come up with something. So I called Gloria House, who was our elected official, and I said, Gloria, I need you to have the House of Representatives call a meeting when we get there so that we can present to them. And Gloria's like, oh, this is a really touchy issue in Gallup. I don't know if we can do it. And so I reported that to Ed, and he says, you know, we're going to get there. Nothing's going to happen. We have to think of something. So I called the governor's office and said, we'd like to have the governor greet us there and call a combined meeting of the Senate and the House. And we got a call back just an hour later and said, oh, the governor's going to be out of state that day. So we called the Senate. I called the Senate and said I wanted to talk to Manny Aragon was in charge at that time. And they said, well, he's tied up. And I said, oh, okay, well, just give him my message and tell him that we don't need the Senate to call a meeting to greet us when we arrive there to address the issues on alcoholism and the indiscriminate sale of alcohol. And they said, what? I said, no, we don't need them to. We already have this lined up. And then I called Gloria House back and I said, Gloria, don't worry about it. I've already called the governor's office. You don't have to have a meeting. And then I called the governor's office and I said, don't worry about it. I've called the Senate and the House. It's taken care of. And then we got a call back from Manny Aragon's office that says the House and the Senate were holding a combined meeting and they would greet us when we got there and we would be able to present to them. And then we got a call from the governor's office that said the governor has canceled his plans. This is so important. He will meet you on the steps of the Capitol building and take you into the joint session of the Senate and the House to present your situation. So we went up, now we had an audience, and we made a presentation, first of all, to get, we made a presentation to get funding for the detox center. We wanted to get $400,000 to study it and to get it built. We were going to get monies to have it built that were going to come from Senator Domenici and Bill Richardson, who was a representative. So we needed to conclude the study first. And our bill had no chance of getting through. And so then Ed called a press conference, and he said, we're closing the drive-up windows throughout the entire state. That's going to be on our agenda. And the liquor dealers, the Liquor Association went bananas. And they're like, what are you doing? And he says, well, we think we have enough, we've got enough votes, we got enough people here, we're going to be heard. So then pretty soon the head of the Liquor Association came and met with us, and they said, look, if you limit closing the drive-up windows to McKinley County, we will guarantee the vote so that you can close the windows in McKinley County and get the funding for everything that you're going to ask. And so Ed and I met, and he said, you know, this is all we want. All we came up here for was McKinley County, so we're really not backing down. He says, what do you say? He said, it's up to you. I said, if we can get the vote right now, let's do it. So they went in, and in 5 minutes, they came back and said, the bill is passed. And Ed, as soon as they left, Ed said, we have just seen the power of the Liquor Association. We have just seen what they can do. So anyway, we came back, and then starts the treatment cycle, the program. We started the detox center, and the hospital took a 2-year turnkey operation. We were going to manage it for 2 years, and we brought on the Navajo tribe, Zuni tribe, city representation, county representation, and we had regular board meetings. And the program was set up to do medical detox and social detox. Following being in there, so people that came in were determined. If they were medically detoxed, they were to go either to RMCH or over to GIMC, and they would be taken care of. If they were not, they were to be in the center for 3 days. At the end of the treatment in the center, the majority of them were sent over to the inpatient program at the East Campus of RMCH, where they were in for a 28-day program. In addition, we had an 18-bed shelter bed program so that adolescents who were picked up for alcohol or substance abuse could get referred into that program without getting a criminal record. The judges would send them in there, they wouldn't have a criminal record, and then they would get rehab while they were in there. The people that were in the rehab, when they came out, we found one of the problems was that they really had no gainful employment. They're going to go back on the streets. So we started a work rehab program. It consisted of several components. One was doing a lot of construction work for people that needed it out on the Navajo reservation. And we went out and we solicited donations to pay for the help to go do that. And we provided all the tools and the manpower and the lumber and different things they needed. Second is we bought equipment, laundry equipment that we put in the old hospital out there. And we had people that worked in the laundry service to do the laundry for the hospital, and the hospital paid for that laundry. Third, we put in a kiln, and we made cups and plates and different things that the Southwest Indian Foundation advertised on a national basis. And so when we would get orders like for 200 cups, then we'd go and buy the materials for those cups. We'd make the cups, we filled their order, they'd pay us for them, and that allowed us to pay the people. At the end of 90 days, the people were able to go out, seek employment, and use us for a reference that we could say they've been through treatment, they've been through a rehab program, they've been gainfully employed, and when my wife and I came here to Gallup this time, and when I say time's relevant, you can picture, I was working with Ed, Munoz back at that time, and I come here and now, and his son says, hey, I want you to help me with this alcohol issue. It's like I'm caught in a time warp. So anyway, we came back about a month ago. My wife and I went over to the college clinic to visit our daughter there, and lo and behold, one person, no last name used, but Petra comes up to see us and knocks on our window so happy and talks to us, and we reminisce. She was the first female client that we had working on the kiln, making cups, and has maintained sobriety for 27 years. So that became, up to that point, now we had something in place. We then applied for a Robert Wood Johnson Foundation grant, and that was going to bring in $3 million to create the Fighting Back Initiative. And we said, you know, this needs to go to a much broader arena. And so we went over to the COG, and Patty Lundstrom, Jeff Kiley, others were involved with that, and we said, go ahead and let's take that program, and that became the entire service. But what's important about that is that we started, remember I started my conversation tonight, we were exactly at the place we are today. But by people pulling together, all of a sudden we had organizations from a number of different places all working to make one continuum of care that produced a lot of sober people in this community. So the question, the last item I'll leave you with, the question is, well, how do you know that worked? We were down in Alpine, Texas, down on the spur of Texas there. I was running a hospital, and I told my wife, hey, look at it. Every year, for virtually 10 years, McKinley County was #1 in alcohol-related deaths. #1 in the nation, or #2. There was a place in Kentucky, and the two of them kind of always fought for that. I said, now take a look at where McKinley County is today. And I handed her the paper, and so she reads through it, and then she reads through it again. And she says, am I missing something here? I said, like what? She said, well, McKinley County's not on this top 10 list. I said, that is what we did. That's what we did. They always were #2, 1 or 2, and now they weren't even on the top 10. That's what can happen if we all pull together. Thank you.
I brought some of the Department of Health data to see if it would help you, if any of it found interesting, if it spoke to you. There we go. So alcohol is a priority issue for the Department of Health. I'd like to always start out with what is our goal. So we're working towards the goal of having a healthy, safe environment for all people. And so the Healthy People 2020 goal, which is what we use as kind of the roadmap for where we're going with health, is that we're reducing substance abuse to protect health and safety and quality of life. And where does data fit in? So data, I'm a data nerd, so I think data fits in everywhere. But not everyone may feel that way. But data is really useful for figuring out developing programs that are really useful for people, for implementing the programs where they're needed most, especially when there's limited resources. And also to evaluate when is a program working and when is maybe something isn't working so great. And also, at the Department of Health, we try and pull data from multiple sources, from vital statistics, from hospitalization data. We also run 2 large surveys among our youth and among our adults. And so I'm going to focus mostly on the vital stats data today because I only have, I think, 10 minutes. So I'm going to go really fast through just a really, really brief part of the data. So one of the reasons why alcohol is such a concern for us is that when we look nationwide, I know this is probably really, really hard to see, but on the bottom there is all of the states in the nation, and New Mexico is that green bar at the far end. So when we look at all of the deaths that are caused by alcohol, New Mexico's almost twice the national rate, and we have the highest rate by far. Our nearest neighbor is Alaska, and they're not very near. So one of the ways that we measure the impact of alcohol in a community is using this idea of alcohol-related death. So it's a calculation that was developed by the CDC, and it looks at many different kinds of causes of death. So not just DWI, motor vehicle crash, but also alcohol poisoning, hypothermia, suicide, homicide. And so that way we can really have a much better idea of what's going on in the community and keep track of when things are getting better and also when there might be some time for concern. 31 of 33 counties in New Mexico are above the national rate. McKinley County is second in the state, so second highest rate in the state. Rio Arriba actually has the highest rate in the state. And there are approximately 80 alcohol-related deaths per year. So it's a good reminder of where we're working towards, that we want to make that 80 a zero is the plan. Oh, I went the wrong way. So what exactly am I talking about when I say alcohol-related death? Like I said, alcohol affects our lives in a lot of different ways. The most common, so this is McKinley County, so this is all alcohol-related deaths. Oh, my slide got totally, oops. Something happened in the translation there. There was a problem when it came off my computer and went onto the church's computer. I apologize. So I'm gonna wing it. So that big, large wedge of the pie that's yellow, that's chronic liver disease. So by far, alcohol-related death in McKinley County is largely due to chronic liver disease. Alcohol is very hard on the liver, so that's definitely an area of concern. We also, alcohol poisoning, which is that you drink so much alcohol that it becomes poisonous. Motor vehicle traffic crash is that purple wedge. So about an eighth of alcohol-related deaths are motor vehicle. And then alcohol abuse and dependence. And then above that is suicide and homicide. So a certain percentage of suicides and homicides probably would not have happened if alcohol wasn't involved. And then there's fall injuries, hypothermia. Oh, thank you. Hypothermia up here, about 3% of alcohol-related deaths are due to hypothermia. And then drug overdose, so a certain percentage of drug overdoses would not have happened if alcohol wasn't involved. So when you mix alcohol and other drugs, they're more deadly than they would be by themselves. And then, like I said, we keep track of a lot of other causes as well that play a much smaller role. Thank you so much for the pointer. So how does McKinley County compare to the state overall? So there are some places where McKinley County is doing a lot better than the rest of the state. So for example, if we look at drug overdose, McKinley County has a significantly lower rate than the rest of the state. Same with fall. Use the pointer again. So drug overdose, fall injuries are also very similar between the state and McKinley County. But we are still concerned about some other causes of death like hypothermia, suicide and homicide, liver cirrhosis, alcohol dependence. This is motor vehicle traffic crash fatalities, so also commonly known as DWI. Alcohol poisoning, and then alcoholic liver disease is definitely an area where we might want to have some focus. If we look at how has alcohol-related mortality changed over time, and I wish I had made this graph a little bit further, especially considering the great talk that we just had, and gone back to the 80s, so we could get a kind of better picture of what's happened throughout history. But so we saw this great dip in alcohol-related mortality, and then it started to kind of go up again, and it's kind of leveled off over the past few years. So it looks like maybe things have not changed drastically in the last few years. And I know that there were some specific concerns that people had about alcohol poisoning, pedestrian fatalities, also hypothermia. So I looked more specifically at those deaths and looked at kind of over time from 2011 to 2014. As you can see, so these are all alcohol poisoning, all pedestrian, all hypothermia deaths grouped together. That's the number of deaths on the side there. And as you can see, they kind of spike in the wintertime and they go down a lot in the summer. And then I know that one of the things that we're kind of talking about is sort of policy changes in the area. And so kind of comparing the number of deaths over time. So the 2 time periods before the policy change and then the 1 time period afterwards. And there isn't a really dramatic change between the two, but those might be some numbers that you might find interesting. This slide is a lot of data packed into one slide, but like I said, I only had 10 minutes, so I had to really pack the data in. So like I said, we do 2 surveys, one among youth, one among adults, and we ask them about their drinking patterns and how much they drink. And so the youth are over here on the left, and the adults are over on the right. So we ask people, have you had any alcohol in the past 30 days? And actually, especially in McKinley County, a really large percentage of people say that they haven't had any alcohol in the last 30 days. There's two what we call patterns of drinking that we find concerning, or excessive drinking. Binge drinking is when you drink a lot in a very small period of time. So like people who, during the work week don't drink at all, but then they go out on the weekend and they have 5 beers in 2 hours. That's binge drinking. Heavy drinking is another pattern that we're concerned about, and that's where people drink a lot, very heavily every day. Binge drinking is kind of really strongly tied to injuries like motor vehicle traffic fatalities, hypothermia. Heavy drinking is more strongly associated with chronic disease, so like chronic liver disease and diseases like that. So, like I said, McKinley County is actually more likely among youth to not have had any alcohol in the last 30 days, and also among adults. And when we look at sort of our patterns of consumption that we're concerned about, McKinley County is either lower than the state or very similar to the state. So if we look at any drinking among youth, McKinley County is lower. Binge drinking among youth, McKinley County is lower. If we look at not excessive drinking among adults in McKinley County, it's very similar. And binge drinking among adults also very similar, and heavy drinking is also much lower in McKinley County than the state. Where there is an area of concern and where there might be some space for some action is that we also ask people, so when you do drink, so among people who do drink, what's the maximum number of drinks that you have in one sitting? Like, what's the most? And so if we look at among those who do drink, McKinley County has, among people who do drink in McKinley County, there's a much higher percentage who drink over 8 drinks in one sitting. So this is usually during like a 2-hour time period. Oh, I went the wrong way again. Sorry, you guys had to struggle through my technical issues with me. There we go. Okay. There's a lot of success stories that I think are important to highlight. Like I said, most adults and most youth do not drink excessively. Alcohol-related motor vehicle traffic crashes in McKinley County have decreased substantially. They've decreased 20% just since 1990. And then binge drinking among youth has also decreased pretty dramatically from 2003 to our most recent survey in 2013. And those are both, I think, I know that there are a number of groups here who are working on those two particular issues, and I think that at least part of that is due to their success and their hard work. There's been a lot of resources and attention to binge drinking among youth and DWI, and I think that we've seen a little bit of payoff because of that. And then also McKinley County does have lower rates than the state for some. So there are some success stories that I think we should really be proud of. But at the same time, there are areas of concern, especially among chronic liver disease, alcohol poisoning, motor vehicle traffic crash fatalities. Alcohol-related mortality is if it's useful, maybe a good measure of kind of how our interventions are doing. So we want to do something that's effective and that will really change the trajectory of that line that I showed a while back of alcohol mortality over time. And so there's fortunately we have a lot of interventions in our toolbox that we can use for alcohol. So the community guide is one of them. The Community Preventative Services Task Force basically looks at like all the literature that's been published, and they compile it. They make recommendations for what's worked in communities and what hasn't worked in communities. And so community guides online, and I put the website there. Thank you.
The Gallup Police Department is charged with enforcing the provisions of the New Mexico Detoxification Act. And we do that with civilian employees most of the time. We call them community service aides. Those are the young men and women that you see driving around picking folks up that meet those requirements as laid out by the Detoxification Act. It's a team effort between the civilian employees, which make up the CSAs, and the law enforcement officers. Because, as you know, the Detoxification Act says that you have to be committed by law enforcement. So when we pick up people and take them to the detox center, they actually have to be signed in there by police officers. So it's a very complicated process, and I know I get a lot of questions at the office as to why they see people walking around that they know they've been drinking, and one of those, I guess the biggest answer for that is you have to be able to meet those requirements as set forth in the Act. If you don't, then we don't pick people up. We don't just arbitrarily drive around town and pick up everybody. That's not the way it works. And people have a right to be in this community, and the police department welcomes every single one of them.
I think it's important tonight that we talk about where we've been, where we're at, and I'm really excited that on the agenda tonight is Ramona Nez, the interim director of the Department of Health of the Navajo Nation, and she's going to tell us where they're going. But contrary to belief, and you all recognize the entire council is here tonight, this is an issue that we talk about quite a bit. I personally talk about it every day in the office. We unfortunately have been dealt a hand here that it's an issue. If it was easy to fix, it had been fixed a long time ago. There's been a lot of good efforts put forward. But this thing doesn't go away, and it's not easy. The advent of all the hard work, I got a kick out of talking with Mr. Conejo and Dr. Carmody, who's coming back, who just was put on the RMCH board last week, that will be coming back into our community, about the history of when Ed Munoz went to Santa Fe, and when RMCH was involved, and when the original NCI building was built. What's important to know is that the funding for NCI through congressional appropriation to deal with Gallup alcohol treatment, that was the language in that appropriation, received $1.5 million a year for a long time. Unfortunately, about 3-4 years ago, the work was done to get that language changed as the Navajo Nation is a fiscal agent, and it was successfully changed. So the operator of NCI, who was the operator for the city and for the county of the local detox and treatment center, all of a sudden started losing their funding. One year they got a few $100,000, they were getting their 1.5, then it dropped down a few hundred, then it dropped to zero. At that point in time, the city was notified that they would be closing the facility because they no longer had that funding, and the city did not have the funding to give them at $1.5 million a year. So NCI did close their operation. Our operator, the city of Gallup, felt the need to keep the facility open and keep a place to shelter people at night. I immediately went out to see President Shelly. And within a short amount of time, President Shelly and my conversations were, it'd be great to get the Navajo Nation partnering with the city and the county to address the issues. That they have a large Department of Health, and they have a division called Behavioral Health that could come in and take the facility over, which as of last January 1st, they signed an agreement and they came in and took over what is then known as Gallup Detox. Unfortunately, it hasn't provided the services that we are all accustomed to that was provided before, at least holding individuals longer than overnight and getting some treatment services provided to them. This has boiled to a head throughout the year. Naturally, we've been jumping up and down and wanting them to commit to the contract that they signed and provide the services that they're obligated to. 1 month ago, when I called the Behavioral Health Services, I said, well, we're about to get into inclement weather. What can you do to take in people? They set a policy they would not take anyone in that wasn't intoxicated. I said, what can you do with inclement weather coming? You're not very busy in providing the counseling and treatment services that you're obligated to. At least take in these unfortunate people that need a safe haven in the evening, because they were refusing them from our protected custody unless they were inebriated. They told me they couldn't do that. The Department of Justice, the Navajo Nation got involved and said it is not our liability and we can't take on because we're federally funded. I quickly reminded them that the city and the county provides $220,000 a year out there. Use our funding. Where's your compassion? Where is it to take care of people that really need help and need shelter and during these cold nights that get real cold? When they refused, we called a meeting. We went to Window Rock. Myself, the city attorney, the city manager, the county attorney, and the county manager went to Window Rock and met with the vice president, his staff, and people from the Behavioral Health and Department of Health. And they still refused me. So I know that there's been a lot of discussion since this last month. I know Ms. Nez will relate to some of those facts. But we have been adamantly trying to get them to proceed under the requirements of the contract that was signed. There wasn't an issue of money. There wasn't an issue of funding. And the whole idea, the method to this was that the Navajo Nation has an in-house treatment center in Shiprock and in Page. They have facilities that they could refer these clients to. This is what President Shelly and I discussed. We get the Navajo Nation in here to help take care of our people and their people. That they have facilities that they can put them into long-term treatment. We haven't got there yet, but I'm real eager to hear, because we have been meeting with Ms. Nez recently. Once again, I referred to her as the interim director of the Department of Health. Mr. Larry Curley, who was the director, is no longer there, who we'd been working with us last year. Unfortunately, Ms. Nez has had to step into a hotbed in an interim position. We also recognize that the Navajo Nation is in the midst of a political election, and that President Shelly, who has worked with me and our council and the city and the county desperately to find the answers to some of these situations, or at least try and help. Mr. Shelly will be stepping out in the middle of January. And at this point in time, we do not know when another election is coming around and who the next Navajo Nation leadership will be. But we're looking real forward to them getting in place. We're confident that Mrs. Nez now, who's just taken on this task recently, is going to come up with some good answers tonight. One of the things that I'm pushing on is the statutes of our state. In 1981, the law was appealed that let Gallup be its local option district where we made decisions for our own community. I presented this to the governor's staff, to the governor, and I asked that our legislators follow through. We need to go back and change that law and give Gallup and McKinley County the local option district back where we can make our own decision on the operation, the hours of operation of the facilities that sell alcohol, and that we have control over some of the licensing issues. This is a big thing. I encourage all of you to talk to your local legislators that we want to repeal that law and get back where Gallup can be a local option district. That's the language. Unfortunately, when this administration came in, as Mr. Cadell stated, before there was an NCI, there was a behavioral health services from RMCH out in Indian Hills on the east end of town. It closed previous to NCI losing their funding. So we've lost a lot of services. I don't say this is unfortunate and bad luck for this administration. I think it's an opportunity now for us to bring things together. The thing I enjoyed the most about visiting with the Navajo Nation It's important that we partner with them, with the county. And a conversation I had with Dr. Carmody and Mr. Cannell a couple of weeks ago was that we all need to come together at the same table. This is a lot bigger problem than one entity can face. The city gets pointed out a lot, and it's on the top of our agenda, and there are answers coming. It's just a frustrating time. What's important to me, and I know this standing council, is that we provide the services that these people so desperately need, and that we hold whoever is operating the facility accountable to provide the detox and treatment services that are needed. And then there's going to be aftercare, there's going to be employment issues. But I think that we're going to hear some good things from Ms. Ramona Nez when it's her turn to speak about where we're going. Thank you.
And in the 1990s, the late 1980s, I remember I was living in California, and I saw on the news, ABC News, Good Morning America, Geraldo Rivera, I saw the massive press release about Gallup being Drunktown, USA. And I think it's a unique opportunity that I saw that at that time, and I knew that I would be involved in something having to do with Gallup. And here I am, 14, 20 years later, working with many people on this issue. And what we're doing is, I'm here representing the Health Alliance, McKinley County Health Alliance with Ophelia. We have an organization that has many partnerships with the hospital, Gallup Indian Medical Center, with RMCH, with all the different treatment providers, and all the people that have signed up on the paper outside. We have an opportunity, you have an opportunity to participate in the steering committee that's going to move forward from here. I like the speech from David Conejo. We have a model already in place. We have the paperwork, we have the planning documents that has been developed by this community, that we can do the same thing. We know it works, so we can do it again. We have people coming together. This is an opportunity for all of us that are coming together right now tonight, that anybody who wants to work on this, who wants to be a part of the steering committee, can be a part of it. It's going to involve mental health services, outpatient treatment, employment services, helping people get back on their feet, housing for people that are in need, and all the different services together. We're working, bringing this community back together, using this as an opportunity, and including mental health services and all the services that have been provided before. So I want to thank all of you. I'm glad that the Senator has pushed this meeting forward and this issue forward. And anybody who wants to participate, there are the papers in the back to sign up, and we're going to move forward from here. Thank you very much.
Alcoholism is a primary chronic disease with genetic and social and psychological, psychosocial and environmental factors influencing its development and manifestation. The disease is often progressive and fatal. According to the Navajo area, IHS 2005 to 2007 reports on mortality, unintentional injuries at 124.4 per 100,000 has occurred, and chronic liver disease and cirrhosis at 37.2 over 100,000 has occurred. According to the Navajo Nation Mortality Report 2006 to 2009, using the Arizona and New Mexico data, it reports that the leading causes of death include, first, unintentional injuries at 107.3% over 100,000, and the fifth leading cause of death is chronic liver disease and cirrhosis at a rate of 32.09 over 100,000. The 12th leading cause of death is alcohol dependent syndrome at 11.6% rate over 100,000. The overarching goal is to reduce the alcohol use and abuse to protect the health, safety, and quality of life for all, especially the youth. The Navajo Nation shares these concerns brought forth this evening. The Navajo Nation has entered into a memorandum of agreement with the City of Gallup and the McKinley County on October 24, 2013. The purposes are to, number one, provide financial resources to ensure comprehensive case management for individuals who are impacted by alcohol and substance abuse, as well as provide prevention, treatment, and aftercare services to individuals. Number two, create long-term planning between the parties in the the MOA, to ensure continuity of comprehensive services. And three, lease property to the Navajo Nation for purposes of providing detox and rehabilitative services. As already stated by presenters before me, on January 1, 2014, the Navajo Department of Health Services began operating the Gallup Detoxification Center. The lowest admissions at the Gallup Detoxification Center was 2,201 in June of 2014, with the highest admissions at 699 in August 2014. Moreover, clients who have been admitted more than 10 times in 1 month is in June 2014 was 1,106 clients. That would be the male, and at 233 for females. In the month of August 2014, we had 1,488 for males and 253 females. To date, the Navajo Nation has expended approximately $582,000. Yes, we do have an award from the City of Gallup, allocated at $320,000. The total that we have expended or have awarded to is approximately $900,000, close to $1 million to operate the Gallup Detoxification Center. The Navajo Nation respectfully requests that the Gallup Police Department resume patrolling the ditches and arroyos and the alleys for individuals who are intoxicated and at the greatest risk to exposure, and to expedite immediate repair to the HVAC system at the Gallup Detoxification building. Today, the Navajo Nation's Department of Health, Department of Behavioral Health Services, and the Gallup Detoxification Center will address the revolving door effect by making the following changes. Number one, contract the services to include medical detoxification treatment at the Gallup Detox Center as a short-term solution. Number two, release a formal request for proposal for a long-term contract to include medical detoxification treatment for an effective treatment plan to the alcohol withdrawal treatment and alcohol cessation programs. Number three, pursuant to the New Mexico Statutes and Code, Section 42-2-2, which is the definition of protective custody, means confinement of an intoxicated person for a period not less than 12 hours and not more than 72 hours, in a length and under conditions consistent to the least drastic means principle. Today, we will look to amend the Gallup Detoxification's policy by A, prior to protective custody admissions, conduct admissions criteria with a more effective clinical approach triage and screen for breath alcohol concentration to determine admissions for either admissions or immediate referral to emergency medical care. B is the protective custody to confine an intoxicated individual not less than 12 hours and not more than 72 hours. So what we're doing is we're expanding our protective custody duration time. C, during protective custody, conduct an initial screening to determine the level of need and treatment of the individuals coming to seek services. D, release or discharge criteria according to the breath alcohol content levels will be determined prior to release. An initial timeline is being addressed to these items to address these short-term and long-term goals. They are in development internally. The estimated annual budget for the Gallup Detoxification Center, including protective custody, intervention and treatment, medical detoxification, and aftercare treatment, is approximately $1.0 million to $2.0 million, which will be determined according to the level of treatment and services that we are about to continue to implement. At this time, we'd like to say thank you. We appreciate the assistance of Senator Munoz, and we do agree that this together we need to address as a whole because of that continuum of care, starting with prevention through treatment, and then also including improving the quality of life. Thank you.
I want to thank everyone for being here. This is a large support for the fight against alcohol. Let me just introduce myself real quick. I know we don't have much time, but I know this is a start. My name is Edmund Yazzie. I represent the eastern side as their council delegate, Church Rock, Daru, Smith Lake, Mariana Lake, and Pinedale. And I also worked with the Sheriff's Department for 17 years, and 1 year with the District Attorney's Office as an investigator. Now involved, as we all call politicians here, involved in tribal government. This is good. This is not only a Navajo issue. This is all race issue here. And I want to get that point straightened out, okay? It's everyone. And I see that Gallup is going to pull again together. I know for a fact, maybe I may be wrong, that there's no liquor bar establishment owner here in this room right now. I might be wrong. Of course there's none, because they are all interested in the mighty dollar. But real quick here, there's a famous rock star, and I always use this on the chambers, and people look at me, especially my elders, thinking I'm crazy, but maybe I am. But there's a famous rock star that said that alcohol is the worst drug in America. Number one, 2 reasons. One, it's legal, and number 2, anyone can buy it. And this was a statement per quota that he stated. And it is true when I think about that. And that rock star is Ozzy Osbourne. And it's surprised when I heard that. And what he stated is what we're facing right now. The Navajo Nation, and I know our president's here, and I know we have our county and our city government here, and I say that it's a first start. Even we have our casinos, which I was against, and I was against the alcohol sale when that was offered to the council. It barely passed. Because we haven't controlled the problem with alcohol. So the step that we're looking at from the nation part, and I met the mayor this morning, we were just having coffee, I was having breakfast at Earl's before going to Winter Rock. I didn't know about this meeting. Of course, I don't read the newspaper, with all due respect. And you know, they said this meeting's coming tonight. It's going to happen tonight, so that's why I showed up. But the nation, we need to pull together, Senator. Just the state, the county, the city leaders, and the Zuni tribe, and us here too as well. The nation is trying to fight this problem. We have our Navajo officers here in uniform here, and I'm glad they're here too as well with our city officers. But we're so behind in our laws that we're trying to catch back up, and we're doing so with the Navajo Nation. There's a legislation going in, and that legislation is to start taxing our own alcohol sales within our casinos. Because I'm telling you, it's making a living. They're making a killing off of that alcohol sale. So that's the first start that the nation is doing. And so with the council, we're trying to combat this problem, but I think, Senator, and to everyone here, and I lost my sister to a drunk driver 5 years ago around this month. And does it hurt? Yeah, it hurts. And it reminds me, she was only 27. And I hear the stories of Mr. Smith, and I know everyone here is impacted by alcohol. And this is the first step, and I'm pleased to see this here. The first church that I see so packed in a while. But this shows that we do care. My challenge, Senator, is that from the council, from the tribal government, and from the state into the county, we got to have more meetings like this. Maybe another march to Santa Fe once again. But this is a first start, and I wanted just to share those thoughts with you, Senator, and I won't go on and on. But we're here from the Navajo Nation Council side, and be here for another 4 years, and then, no more after that for me as well. So